Hello, friends. It's Dr. Kimberly back in my home office, and I just got back from walking about 45 minutes around my neighborhood this morning. It's a beautiful Saturday morning here, just outside of Austin, Texas. And today I thought I would share a topic that's near and dear to my heart, although not that close to my heart. It's actually about my feet. I don't know about you, but as I've gotten older and I'm in my very late 50s now, things just hurt more than they did when I was young. And particularly, I've had some issues with my feet, with a nerve that gets angry in the metatarsal area. It's called a neuroma. So I've had to do some things to deal with that so that I could just continue to enjoy all of my normal activities. And I think that perhaps that issue has been aggravated over the years because I've been a long-standing over-pronator. And so we'll talk about that too. Now, I want to put a disclaimer out here before I share the things that are working for me and making my feet feel more comfortable, is that, I go by Dr. Kimberly as my brand, and I hold a doctorate degree. That degree is in technology and business. And I've done some teaching at the undergraduate and graduate level, and I have spent the entirety of my more than 35-year working career in the healthcare technology space. However, I am not a licensed medical practitioner, so you cannot take advice directly from me and use it as a prescription for what is ailing you. You always need to seek out care from your own licensed medical practitioner. All right, so with those disclaimers, I do want to share what's been working for me because I'm of the mindset that I want to maintain a very healthy and active lifestyle. And I don't want to be dependent on medications. And I don't want to go through a surgical intervention and put myself at risk for potentially creating more problems. So for instance, the issue with the nerve in my foot, and, when I saw a podiatrist, I was told, there are things they could do. They could surgically go in to the foot and pluck that bad nerve out. But in doing my own research online, I found that a lot of people had consequences from that type of surgery. And so I am using more conservative approaches to deal with my problems. And those approaches are working out really well for me. So I thought I would share them. So first of all, oftentimes when you go to a podiatrist, they will offer to create an orthotic for you for your shoe, and you can certainly go that route. They will measure your foot precisely, and you will spend hundreds of dollars for a single orthotic. Now, as I mentioned, I am over-pronating, which means that, when my foot is like this, it's actually, my left foot is tilting in from the ankle towards the right. So when I just stand in a relaxed position, if I'm not having any kind of supportive device in my shoe, my ankle turns over to the right. And what's happened is after years of walking around like that, it's created some imbalances in my body. And I think that sometimes exacerbates some pain that I'll get in my hip around the sacro-iliac joint. And occasionally that contributes to some sciatica. So there's all these issues when your spine and your body's out of balance, because your feet, which is giving you your foundation for your gait, and which you're dependent upon all the time that you're walking and standing, when that's out of balance, it's just a snowball effect from there. So this was a way that I could really identify the severity of the over-pronation of my foot. These are a very well-worn, well-used pair of Birkenstocks, and I wasn't wearing any kind of orthotic in the shoe. And as you can see, it wore tremendously down here. And that's a result of that over-pronation on my left foot. In fact, when you see the shoe, the other shoe, you can see that I actually have that problem bilaterally or on both feet. So, I had, you know, looked into orthotics and have played around with them, but I wasn't religiously using them. And so now I am. And what's different about my approach to the orthotics now is that I am keeping them in my shoes constantly. So I'm just going to slip off this shoe that I'm wearing right now, and you can see that I have an orthotic in here. And in fact, it's one that I bought on Amazon. And if you can see that, a little hard to see. I know there's some shiny reflection there, but it's called Pedag, P-E-D-A-G, Pedag Holiday. And this is a size 39. And you buy a pair and they insert into the shoe like that. Now, they don't stay in the shoe. So because, they're really meant so that you could transport these to your other shoes. And this is where I want to talk about having a couple of different types of orthotics, because I've also got this one. And you might notice this one's called Ortha Heel. So it's O-R-T-H-A instead of ortho, which is the appropriate prefix. But Ortha Heel is this brand. And it's actually, it tells you on the shoe whether it's right or left. It tells you on the insert whether it's for your left or your right foot. Okay, and I'm just going to hold these up so that you see a little bit of a difference in these. What you might notice is there, I think that's a better view, is that this Ortha heel has a much more significantly pronounced kind of cupping around the back of the foot, and significantly more, I would say, arch support than this one. Okay. And I actually like both of these because I don't wear the same shoe all the time. And in fact, my Birkenstocks, like this one, have the traditional, what's called hard sole. Birkenstock has come out with a softer sole, but if you need a really good supportive shoe, I recommend going with the hard sole. It forms to your feet. And this has probably been the most comfortable shoe I've ever worn. Once you break them in so that everything's comfortable around your foot, it just is an amazing, amazing footbed, an amazing shoe to wear. Because it has such a highly structured and rigid footbed that conforms to your foot, if I put this orthotic in that has the higher structure to it around the arch and the back of the foot, it's too much in this shoe. However, when I walk in these shoes, and this is called Northside by Northside, it's kind of like a Merrill, kind of a trek shoe. And I like to hike outdoors in this shoe because it's got the back ankle strap. Well, the base of this shoe is not as rigid as the Birkenstock. And so the base of the sole is not as hard and supportive. And so I actually find that I want to have the larger support in this type of shoe. And so when I put this in here, I actually, this is the right shoe, and this is the right insert. When I put this in here, then I don't know if you can see it, this comes up higher, and it's going to prevent my ankle from over-pronating. It's going to keep it in a perpendicular position to my foot, very perpendicular. So you can see that, I have different shoes that I want to wear with my inserts. This is actually another pair of Birkenstocks. And again, because this pair of Birkenstocks also has the hard insole that forms to your foot, I again prefer this Pedag, the rigid insert orthotic device that's still a bit smaller than that ortho-heel one. Now, what I have found is, because I'll often hike for 4 miles or so, and if I'm doing a ton of walking, then what I find is sometimes these orthotics want to kind of slip around and slip out the back of the heel. So what I have done now, and I'm in the process of doing with all of these, is I have added Velcro. And I think that this is a great option. So I've got a Velcro strip there and one here. And now I'm going to be putting Velcro in this shoe, and I'll be putting Velcro in this shoe, and I'll be putting the matching Velcro on the back of all of my orthotic devices. And so I have about 4 sets, 2 each of each type. But I'll still be able to pull them out of a shoe. If I buy a new shoe, all I'll need to do is put the Velcro on the bottom of the new shoe, the bottom of the inside insole, and use the Velcro that's already existing on my current insole to keep that in place. And like I said, today I walked a couple of miles in these shoes after putting the Velcro in there. They stayed perfectly in place, and I was incredibly comfortable during my entire walk. So I would highly recommend, well, first of all, as I did, take a look at your shoes and see if you've got an issue like I did with over-pronation. Now moving forward, because I am Velcroing in the orthotic inserts into every shoe that I'm going to wear, I feel like I'm going to preserve the life of my shoes much better. And my whole body is just going to be happier because I'm going to be keeping my structure in alignment, and I won't be exerting undue wear and tear on joints, because my body, when you overpronate, your body tries to overcompensate because it wants you to land your foot correctly when you're walking. And so it's manipulating your body to try to make that happen. And that just gets everything out of whack. So I also mentioned that, I deal with that neuroma that's in the metatarsal region. So just, where the kind of the thickest pad part of your foot is behind the base of your toes, before you get to your arch. If you press in there, you can feel the heads of those metatarsal bones. And oftentimes, kind of right here, really it's about right here behind the bones of your foot. It's not uncommon, particularly for women in their 50s, to develop a neuroma. And that's just an inflamed nerve that's getting too much compression, oftentimes from having worn improper shoes that squeezed your foot. So if you had a long life of wearing high heels and other shoes that weren't good for your feet, and you had this constant compression on your feet because you were putting them in pointy shoes, well, when you're in your 50s, you may get a wake-up call with a neuroma like I did. And I've not been able to get that neuroma to go away, even though, I pretty much only wear wide shoe beds now that give my toes plenty of room. But I also find that I still need support or cushion for that neuroma so that I don't have any pain at all when I'm biking and walking and doing all of my regular exercise and just day-to-day living. And so I get these metatarsal felt pads. This one is a 1/4 inch thick by Mars Wellness. I just order them from Amazon. I order several packs at a time, and I can wear one of these pads on the bottom of my foot where that nerve is. It just sticks to the bottom of my foot for about 2 to 3 days. And then the thickness starts to thin out just from your body weight wearing it so much. When I go to take a shower, of course, or if I'm going into the pool, I pull it off my foot, but it's very, very sticky. And I find that I can stick it back on my foot and do that for 2 to 3 days at a time. But the combination of wearing one of these pads, in addition to the use of the orthotic in my shoe, has meant that I have had the ability to pursue all of my normal activities. I've been able to hike, 4 or 5 miles on nature trails in unstable conditions out in the woods. I've been able to bike on our e-bikes with my husband, for 16 miles. I am just managing the condition that I have in the most conservative way. So I hope that you found this information helpful. I hope that if you have any of these similar issues, that you're finding ways to deal with it in a conservative way too, that's keeping you healthy and happy and able to enjoy your life on a daily basis. So thanks for tuning in with me. Wishing you a blessed day. Have a great one. Thanks.